Hi, I'm Dr. Thomas Su of ArtLipo Plastic Surgery, and today I'd like to talk about something that you may have curiosity about. What is lipedema, and how do you know if you have it? Lipedema is a disease. It's a disease or disorder of the fat that is pretty easily recognizable even without any kind of test or diagnostic procedure. It's recognizable because it causes a fat accumulation in certain areas, more concentrated on the legs, starting around the ankles and progressing all the way up into the thighs. What is recognizable is that the fat is often way out of proportion on a woman's body, mainly accumulating on their legs while sparing or relatively sparing their torso, their tummy, their upper body. However, lipedema can also affect the arms. So you'll see in patients with lipedema, probably about a third of them will also have heavy arms as well as heavy legs. So this is the easily recognizable part if you look at someone with lipedema. But there are also symptoms that go along with many cases, maybe not all cases of lipedema, but many cases of patients with lipedema struggle with painful fat. And this is something that it does not happen with any other type of disorder. Patients with lipedema oftentimes have tenderness that is elicited just by light touch, sometimes just by crossing their legs, sometimes by brushing against something, having something accidentally touch their legs. It's painful, it's tender. These symptoms are very debilitating in many cases. In some cases where it's severe, patients actually walk with a wider stance to avoid their inner thighs rubbing. And this can lead to unusual pressure on the knee joints, causing early breakdown, osteoarthritis, and early need for joint replacement. So lipedema can have some very severe disabling consequences, even by a woman's middle age in their 40s or 50s. It is a disorder of accumulation of fat that is not like any other fat. So whereas much of society would say a person with heavier legs is just because they don't diet or exercise, they're not doing the right things to get rid of this fat is different. It's very different in a way that it's not metabolically active. Even when patients are losing a significant amount of weight, when they're dieting and eating all the right things, their fat from their legs is not going away. So this is one of the major differences between lipedema and normal fat. Lipedema is something that is very poorly understood right now. We don't really know where it comes from. I think it's speculated that it is a genetic problem because it does often run in families. However, beyond that, we don't actually know what causes it. What can be done about it? We don't understand the metabolic nature of the fat cells that have been studied in patients with lipedema. So what we have here is a disabling disorder that causes an unusual accumulation of fat and body shape. And besides the physical type of issues that are involved with lipedema, we also have a very strong component of emotional distress, because patients that suffer with lipedema oftentimes are very self-conscious. They're teased or made fun of very early on for something that's out of their control. So emotionally, this is a very disabling type of problem that can lead to depression over time. And up until recently, most women just blamed themselves. They didn't understand that this was a disease process. So those are the main issues with lipedema. And how do you know if you have it? Well, lipedema is recognizable, like I said, by appearance. That is one major factor. Now, if you have symptoms of tenderness that's associated with light touch in areas that you have this fat accumulation, if you have symptoms, that is a strong suggestion, probably a 90% likelihood that you do have lipedema. The other thing is, patients with lipedema also have easy bruising. They can also have hypermobility or distensibility of their joints. So a woman with lipedema can oftentimes bend their wrist joints significantly. Instead of bringing their arm down to a straight, they can actually hyperextend and let that joint even move into further curve backwards. So these are some associated things. However, lipedema is mostly diagnosed through appearance and through symptomatology. When I treat someone with lipedema, usually the diagnosis is already 99% made just from those two things that I talked about. There are some things that can lead to thicker ankles, puffier ankles, that is not lipedema. So some of the diagnostic tests that are available, which would be ultrasounds, MRIs, are not necessary, but some doctors do go so far as to get ultrasonic evaluation of the lower extremities to make sure it's not incompetent veins, because incompetent veins can lead to backup pressure, which can cause edema in the legs. Edema is fluid. So some patients, if they're not seen beforehand, could actually have fluid. Usually you can tell the difference between fluid and fat just because of the pattern. Fluid does move down into the feet also, whereas the feet are very spared in most cases of lipedema, which is fat. So the fat stops at the ankles usually. So in any case, there really isn't any laboratory diagnosis or diagnostic importance of ultrasounds and blood tests. It's mostly a diagnosis of examination and also by history of what a patient's experienced. In any case, if you're not sure if you have lipedema or if it's something else, you can actually get an evaluation by your primary care doctor, who may also want to send you to a venous or lymphatic specialist to do some further studies. After you have that done, if you have a diagnosis of lipedema, it is a disorder that is very responsive to liposuction. I am a liposuction specialist in treating lipedema that has treated over 500 patients. If you're interested, please give us a call, contact us, and we'd be happy to answer your questions about what we think we can accomplish with you. Thank you for watching.